at UCLA and am part of the global health program. And we currently are just in the midst of this new sort of local, global, what we're calling kind of exploring health disparities in the context of local and global communities right now. So we have 5 students that are just in the midst of this elective in their 3rd week, where they've been all over kind of Los Angeles, learning about different underserved communities with special needs, kind of interfacing a little bit outside of their usual scope that they're used to in West LA. So it's, I think, hopefully been a really great experience for them. And we wanted to give them an opportunity to learn from all of you great leaders who do a lot of advocacy and activism work in the community, and just learning about how they may be able to continue some of this work and get more involved as they transition from medical school into residency. So thank you all for joining us. It is a pretty small group, so I'm hoping that it will be very conversational and just allowing the students a real opportunity to ask their questions and get to know you all really well. So I think Vegeta was going to drop the link to the bios of all of our panelists, just so the students have that readily available if they need anything for reference. But without kind of further delay, because I want to be mindful of everyone's time, we can just start by having each of our panelists introduce themselves, and then if you could talk a little bit about your kind of career journey and kind of how you became involved in advocacy and sort of your path to the work that you're doing right now. Anyone want to start? Or I can choose.
I can start.
Great.
Hi, everyone. My name's Hannah. Feel free to use my first name. I am an emergency medicine attending and also a fellow, non-ACDME fellow at UCLA right now. I'm doing the IDEAL Fellowship, which is International and Domestic Health Equity and Leadership, which involves doing a master's and then just working on projects that have to do with either international or domestic or both health equity. Let's see. Oh, how did I get here? Wow, that's a long question. I have not had a straight path, and I think that most people haven't had a straight path, but you kind of have to make it into a straight path for people to digest, especially in the medical setting. So this is the best I can do for that. I studied comparative history of ideas in college. By that point, I was already kind of oriented from where I grew up, which is an extremely racially and economically diverse area, to the fact that, there wasn't equity at all between people, and that was really just based on where you were born, what family you were born into. So I already kind of knew that, the basic premise that I had been told, which was that like all people are created equal, wasn't really true. And so with that sort of consciousness, and then doing in college, I kind of was able to further explore like how these different ideas and histories kind of moved through and progressed through the years, and how different larger structural forces ended up creating systems of oppression and inequity that ended up causing a lot of the downstream effects that we see today in all aspects of society, including in medicine. And during the time I was in college, actually, there was like a lot going on with police violence at that time. This was in the early 2000s. There was also a lot going on with the war in Afghanistan and the war in Iraq. And I got really galvanized and kind of started doing a lot of activist work with the local community around forced registrations of the immigrant population at that time, and also the war in Iraq and Afghanistan. And then after college, I ended up moving abroad and living abroad for 7 or 8 years in Bolivia and Cuba and sometime in the Middle East, and ended up deciding that I wanted to continue my activism, but I wanted to continue it through with additional tools that I didn't have, one of which was medicine. So I was already really involved in advocacy and activism, real grassroots activism from the beginning. And so when I came into medicine, I was like, the first thing my sister, who's actually a doctor, told me was that I was going to hate it because it was so hierarchical and I hate hierarchy. So she was like, you're just going to hate it. And it's true. I really do hate that part of medicine. It's one of the things I despise about medicine. But I think when I first came into medicine, I think probably some of you guys will be able to empathize with this, was that if you were at all activist or advocacy minded prior to medical school, was that I felt like I had to like bury that part of myself in medicine, or else like I wasn't going to somehow succeed. And I think a lot of my struggle through medical school and then residency was like learning how to preserve that part of myself and then be courageous enough to like just be out there trying to use my privilege and risk my privilege to create change. And doing that with the tools that I was given, both inside of the medical context with my peers and colleagues and my quote unquote superiors, and also with the communities that I was serving. So right now, currently, I think the biggest projects I have are with some projects with the LGBT community here in Los Angeles related to pre-hospital care, and also at the US-Mexico border, where I run a nonprofit that serves migrants and refugees and has a large LGBTQ program. A lot of the work that I do trying to rid hospitals and healthcare in general of law enforcement and other police and punitive presence inside care systems. Yeah, I hope that's a good enough summary. Feel free to ask me any questions today. Like I said, I really feel like one of the biggest things that is made it so that medicine has not been able to evolve as it should have evolved is secondary to the medical hierarchy. I think it stifles innovation and it stifles creativity, and it makes it so that we can't work together to try to create solutions to things. And so I'm really happy to engage with all of you guys and to do it on a very level plane. And so I look forward to our conversations.
Thanks, Hannah. Definitely not a straight route, but for many people, I think, as much as we like to make medicine really straight, if you have other interests, that's usually what it is. You're kind of curving and moving, and I think it's great for the students to see that that's okay. Abby, do you want to go next?
Sure. I'm Abby Aarons. I'm a third-year med peds resident right now at UCLA. And my path, maybe a little bit more direct, but not completely traditional. So I did pre-med undergrad, but I decided after medical school that I wanted to work on issues of health disparities. And so what I ended up doing was getting a master in public policy straight off the bat. And that happened to be right when the ACA was getting passed. And so through that and some internships, I fell into working in DC for a few years, and my master's and then directly into medical school turned into more like a 6-year gap between undergrad and medical school. But I had some really great experience working on a huge variety of issues related to ACA implementation at the state level, because there was just a lot going on at that time. Then I did, after a couple of years, decide I wanted more of that direct patient contact. So I did, at that point, decide to go to medical school, and I went to UCSF, where I had the opportunity to work a lot of my fourth year, a little bit or before that, but a lot of my fourth year I spent working with their two different research groups there, doing a bit more policy research and some of their social determinants of health, like implementation side of things. So that's kind of how I got to UCLA. And where I hope to go is a career doing primary care, med peds, and also policy research. But along the way, I'm the kind of person who gets involved in lots of things. So one of my roles right now is I'm helping lead the UACT organization that Grace, who's here, is also part of, the leadership team of. And that is a new organization where we're working with a group of faculty and residents to try to coordinate advocacy efforts and advocacy education across different residency programs at UCLA. And I would say that education on advocacy and policy more broadly for people in medicine has been one of my passions, actually, even before I started medical school, because I think I've seen from the policy side that physicians have a really strong voice and not always enough sort of background education and tools to use that voice. And so I think bridging that gap, and I think the want is there. When there's surveys of medical students, it's like over 90% want to learn about advocacy, but it's really the level of advocacy education we get doesn't always equip us. So that's one thing I've been working on with UI.
Great, thank you. And hopefully, I know many of our students are not necessarily at UCLA, but letting their friends know who are here about getting involved in UACT if they're interested. And then, sometimes it's not as obvious, but wherever you go, asking around like what is going on in terms of advocacy at their institutions to get an idea, or maybe this will motivate you to be the pioneer of something similar where you move on. So, thanks, Abby. Kimberly, do you want to go ahead and introduce yourself?
Yeah, sure. Hi, everyone. I'm Kimberly Plotnick. I am not a physician. I am an attorney, and I am the program director at Esperanza Immigrant Rights Project, which is a nonprofit legal services organization that's part of Catholic Charities of Los Angeles. So we are a service provider offering assistance to some of the most vulnerable immigrants facing removal in the US. So you're probably seeing a lot in the news, in the media, about migrant children coming to the US at the moment. That is a population that we traditionally help and are preparing to assist as they make their way up to Los Angeles or greater Los Angeles area. We help a lot of our clients are families that were formerly separated at the border. We serve a lot of people in detention. So really, people that have extremely complex immigration cases and a lot at stake. The process for them is really overwhelming. And so our role includes providing education to them about the process, how to navigate their way through, information on how to represent themselves, and then in certain cases, or in a lot of cases, we actually represent them in court. So our advocacy is not sort of like a national policy advocacy, but at more of the individual level in the courtroom, and assisting them to advocate for themselves by way of giving them that information and education. It was good to hear stories from some of the other panelists about sort of not particularly direct career paths, because that, I think, is certainly my story and my family history, and my personal experience sort of drew me to work in this area. So, I mean, I'm Australian born. I'm the granddaughter of Polish Jews who fled before the Holocaust in Europe, although they lost several family members, and obviously the impact on a community spans generations. And so I grew up with those stories and that history, and that's really the lens through which I viewed the world as a young person, learning, genocide must never happen again. And then, of course, no, it still happens today. And individuals continue to be persecuted by governments and non-government actors for immutable fundamental characteristics. And so this was something that really I wanted to be involved in. But as I said, my path was certainly not clear and direct. I worked in corporate law in Australia for a couple of years. And when I moved, looking at how to assist on a pro bono basis, but when I moved to the US in 2012, I decided this would be the opportunity to shift gears and really get into what I had always wanted to do. And so I threw myself into it. I actually did a Master's of Law at UCLA, and threw myself into every other opportunity, volunteering with service providers here, working with the UN in Uganda. I did civil rights at the Anti-Defamation League for a few years, and as I said, now I'm working at Esperanza Immigrant Rights Project. So not a clear path, but I think that is a common story nowadays. And so I would say to anyone, whether you're like in the medical profession or the legal profession or anything else, it's just about taking every opportunity as it comes up, knowing that you're on a path forward. And even though it can seem daunting at the outset, it will move you forward to hopefully a place that you're doing what you're passionate about and helping people.
Thank you, Kimberly. That was really great to hear, and really great advice for all of us to think about taking those opportunities and thinking about moving forward and ahead. I'll have Grace introduce herself. I know we've all kind of interacted with her, but I'll let her kind of talk a little bit more about her journey as well.
Hi, I met you all last week when we started our UX collaboration. And before I introduce myself, just for the other panelists, I've been working with our students on actual advocacy. So you can see, if you follow UX social media accounts on Instagram, it's UX_, you'll be able to see the posts that the students have been creating over the past week, highlighting some of the different organizations that they've been going to, and they have some really, really awesome posts coming forward. So just wanted to start by highlighting their incredible advocacy work. So about me, I also had a really non-direct path to medicine and with advocacy. So I ended up taking 7 years off between undergrad and med school. Hannah, I think based on the major that you said, I think we both went to the University of Washington, because there's nowhere else where I've heard that major before. But I grew up in Washington State mostly, came here after college to LA to do Teach for America. And at the time really was not super aware of the world. And, I was obviously aware of educational disparities because I was coming here for Teach for America, but really came here with kind of a savior complex, and definitely, was bright-eyed, bushy-tailed, very excited to change the world. And then I got here and ended up just really falling in love with my kids and their families, and forging really strong bonds with them, and still friends with most of my students who I taught, and still in touch with them in many ways. And I ended up teaching for 4 years in LA, and through that experience just really had my eyes open to all sorts of disparities, health disparities being one of those, and became a lot more motivated to take care of those issues, and whether a kid knew what a cell was or not. So that kind of got me on the path towards medicine. And then after teaching, I worked in education policy for a little bit, and then ran operations for a tech startup that is, I was like employee 6, and now they're huge. It was a totally different experience. So on the side, I was volunteering at the Berkeley Free Clinic as an HIV test counselor. And through all these different experiences was advocacy for me it was really centered in the community and around my students, and really just wanting to come back and make sure that my kids, you know, could have the lives that they wanted. And that was really like my driving force behind the advocacy that I did. That brought me back to UCLA, as the students here know, and then through Prime was able to keep doing lots of advocacy work, and was really lucky to meet many other med students who are also really focused on advocacy. And so was focused largely on supporting undocumented medical students during med school through UndocuMed, but also was involved in LMSA and several other different organizations. And I think, like Abby, also just found myself picking up things here and there along the path. And just, for me, advocacy has always been about, I guess, finding those genuine connections and seeing how I can connect whatever resources I have or the people I know to others, to sort of bolster whatever amazing work is already going on. And so by the time I got to residency, I actually, as a fourth year med student, when I was interviewing for different residency programs, it was really important to me to find a program that had a strong advocacy component. And I saw all these really great things that were happening at different programs. And I actually went back to one of the rising chief residents of the UCLA Peds program. And before I had matched or anything, was like, hey, just FYI, I'm seeing these like great things at all these programs. Do you think UCLA could do this or something like this? And that was Lisa Ganson. She ran with it, applied for a grant with the AAP, and ended up creating the Peds Resident Advocacy Council out of some conversations that we had based on advocacy work and different models that were happening at like Stanford and several other institutions. And Umlu, who has not been able to turn yet because she is currently staffing a patient in the ED. Umlu Natason is one of our current chief residents, and she is actually the person who leads the Peds Resident Advocacy Council this year. And she's really grown that advocacy council to be like a much bigger structure even than it was last year, with faculty mentors and frequent noon conferences given by different residents. And, you know, I say all this, one, to introduce Umlu's advocacy work, but also to highlight what you can do when you go off to residency, and just, you can take the ideas that you've seen around you, the things that you liked from different programs as you interviewed, and plant those seeds in, you know, in different people's heads, so that hopefully wherever you end up, if you don't fall into an advocacy environment that is exactly what you want, you can help make it something closer to that. So that's where I'm at now. And then ultimately, I hope to have a career in primary care, gen peds, doing probably county level policy work, but we'll see. I, like Abby, am open to lots of different things.
Great, thank you, Grace. I feel like every time I hear you introduce yourself, I'm like, oh, wow, I forgot, like, you've done this amazing work and you've done this. So thank you for being here, and thank you for kind of mentoring the students through their advocacy work in the last couple of weeks. I think I agree. The posts are fantastic. I'm, you know, really excited about this. So thank you for that. So I think when Amlu joins, we'll have her introduce herself. But you know, we certainly want to open this up for questions from the students. And I think as everyone's sort of thinking, you know, Gracie started talking about this, but I'd love for you or Hannah or Abby just to kind of maybe comment on, you know, what might be some advice or some steps that you think students could take as they're transitioning from being a student into a resident, in trying to get more involved in advocacy and policy work, like you mentioned. I think a lot of times people hesitate to take that first step because they say, oh, well, I don't know what I'm, you know, if I really know what I'm doing, or if I have all the tools, and then don't quite jump off. So it'd be great to kind of hear your advice in that.
Sure, I can start. So I recently did an advocacy workshop with a lot of our graduating medicine third year residents, and they similarly had that question. And so I don't pretend to say that there's an easy way to incorporate advocacy into your residency. But I think the point that I worked on it with one of the CARDS fellows too, Ruth Shao. And I think the point that resonated with me, and as I think with them, is that advocacy is a pretty broad category of things. It's not just, you know, going out into the community and working with a nonprofit on a specific issue and getting that issue passed through like some sort of legislation. Advocacy can be like the point of your QI project is having better access to language services in the department, or it could be that the point of, you know, you're writing a research question for, you know, your 4-week research block, and you bring in the question of how does this actually affect at policy or advocacy? What are the actual implications of my research? Or even when you see something with your team and you're on the wards and it just doesn't sit right with you, just calling that out and hosting a discussion with your co-residents. So I think recognizing that a lot of what we already do in our day-to-day work can be advocacy makes it feel a little bit less daunting when you're in residency and you feel like, I care about these issues, but I just don't have time for anything else. So at least for me, in residency, I have found it pretty hard to carve out time for research and UACT and all of these things that, you know, I think it does take this extra commitment and motivation that I don't expect everybody to be able to, you know, that's not everybody's top priority. But just recognizing that you are empowered just in your day-to-day work.
Great, thanks, Abby. Hannah, I don't know if you want to comment. I also would love for you to maybe talk a little bit about how activism is you know, how it kind of differs or from advocacy, and how students can get more involved, or all of us can get more involved in activism.
Yeah, I think, you know, you can think about advocacy. I kind of like to break it up into like inside and outside strategies. And that might not be how you kind of think about it, like working inside or outside the system, which is one way you can think of it. But also there's like inside and outside strategies for like who you're going to target. Are you going to target the people on the inside, or are you targeting like the general public who can then pressure the inside from the outside? Which is the way that I prefer to think about it. I personally would probably say that I don't do very much policy work, although some people might disagree with me, because a lot of the work I do at the border and a lot of the activism that we do at the border does really directly influence policy. And I've met with some high-level people in the administration, secondary to the activism actually that I did there. So I think, you know, where is the line between advocacy and activism? I'm not sure. I think, you know, for me, I feel like there are a lot of people who are willing to do advocacy work, like more traditional advocacy work related to public policy and lobbying and trying to pressure individuals from the outside, like kind of from the inside. And so since I have a background in more traditional sort of grassroots activism, and it's riskier and less people are willing to do it, then I tend to think that that's where I should direct my energy. So I tend to do things that have more, I think they probably have a lot more implications for like, you know, my career and, you know, my ability to roam free on the planet than say most people would feel comfortable doing. But I think they're really important. I mean, I told you that like I studied history. So I actually think, you know, based on that really change doesn't happen unless people are willing to risk privilege. And I think, unfortunately, a lot of human history has shown people who don't have a lot of privilege ending up being those people who risk the little privilege they have. And I think as doctors, you know, no matter, everyone's going to enter in with their own individual level of privilege, but in general, just as a category of doctors in society in the United States, we do have a fair amount of privilege just from, you know, how people look at us in terms of our position in society. And I think you can use that to, you know, create awareness around an event, and you can use that in your activism itself. So, I mean, I can give you an example. So, you know, last year we were trying to bring some light to, we tried every way through policy, through lobbying to get CBP, which is Customs and Border Patrol, to vaccinate children in the detention centers along the border, and they wouldn't. So we basically designed a very large protest action based on, you know, a lot of experience that me and some other physicians had had in the past, just like from our grassroots activism. And we got a bunch of people, some people who are willing to be involved in a direct action, and other people who are just willing to protest. And we went and did a 3-day series of protests and direct actions down in San Diego at the border. One was at a detention facility, one was at their headquarters, and one was at the border itself. And during one of those days, the second day, when, you know, the first day we tried to go and vaccinate people with an entire vaccination team and vaccines, and they turned us away. And the second day we went to their headquarters and tried and met with them. So first I went inside met with them, and, you know, the runaround as usual. And then we said, we're not leaving until, you know, we have an answer. And they didn't give us an answer. So we blocked their entire facility. So no one could leave or enter, and we were arrested and charged with federal charges. And some people might think, oh, wow, that's really extreme. Like, why do you have to do that? But the thing is that there was no movement through traditional policy. And it wasn't even just like us, it was also just people, like we had Congress people working with us, and there was no movement. So as a result of that, we actually got invited. So, I mean, it was video recorded, very purposefully and very intentionally. It was video recorded by many people, including multiple news outlets. It was all over. The video was retweeted like 4 million times because it showed a bunch of really militarized police arresting a bunch of people in white coats who were just like, all we want to do is vaccinate children. And it looked really bad. So, I mean, that is a form of activism. And as a result, we actually gained some traction in Washington to be able to meet with CBP and tried to work out a plan with them for how they were going to vaccinate people. So I think, you know, you can, you know, the federal charges, you know, we went into that it was a very planned action. So we knew the legal ramifications, and we also knew what it could mean for our careers and for medical licenses and all these things. And we were able to successfully defeat the charges that time. But I think, you know, the point is that action gained more traction and had more power than just being able to do traditional lobbying and public policy in that moment. So I think, you know, really my point is this. There are a lot of tools you can use to create change, okay? And sometimes the best tool is to go write an op-ed or a lobby. What I want you to know is that there are a bunch of other tools that you can use, and one of them might be lying in front of a building and getting arrested in the right moment for the right cause. And as long as you can realize that and realize what those tools are and make a plan to try to tackle each objective, I think it's totally reasonable as a physician to use the privilege that you have to and those means to try to achieve change. And, you know, our country and a lot of the civil rights movements and other movements in the world have been founded on that sort of direct action. So that's the kind of work that I do, and I'm really happy to talk to anyone about it more in depth offline about what are the, you know, how you make those decisions and what risk are you willing to take and what are the consequences, because I think those are really important questions you have to ask yourself. But that's just an example of how a group of physicians came together and did something that isn't traditionally thought of as physician advocacy.
Thank you for sharing all that, Hannah. It's actually really inspiring to hear that and just sort of see how kind of working outside of some of our traditional comfort zones and being able to really, you know, push the system and really try to make those changes that we're all passionate about. So, you know, appreciate you, all of the work that you're doing and for sharing all of this here with us. Kind of sort of related to what you were talking about, I think that there could be potential legal ramifications when interacting in ways you described, and I wanted to point out the fact that you said this was very planned. So I think that is very key, in terms of kind of thinking through what could be potential legal repercussions, who you would call, what is the system sort of in place when thinking through actions such as these. But I also wonder if any of the panelists want to comment about maybe feeling some of that internal repercussions, being maybe in an environment where you may not feel like your direct leadership or the greater leadership is supportive of actions, and how you sort of struggle with that, or how you kind of overcome those challenges.
I think I'm well placed to comment on that a little bit. I have an assistant here, but she's pretty well behaved. I think that the issue you've just raised is something that I know my team grapples with a lot. We are a legal service providers. We are a team of attorneys, and primarily, and so people really need to be focused on their legal obligations to their clients to get the case outcome that we're trying to. However, as advocates, hold on one second, Dad, can you take her? As advocates, we really do recognise that exactly what Hannah was saying. There's not just one type of advocacy to get the job done. And if you are attached to this one pathway, then you might not get the outcome. You have to be looking at it from different perspectives. You have to have assess what is going to make a change. And so as legal advocates, we're collaborating with other advocates all the time. We actually hosted a panel last week with a community advocacy group, because we had been working together on raising awareness about one of our long-term clients that very tragically died in detention just last month. He had been in detention at Adelanto detention facility. He was very high risk due to a range of medical conditions, and our attorney had been advocating for many months to get him out due to COVID. And he'd even been ordered released at one point. However, it fell through when his housing fell through, and then mysteriously we did not know where he was. Our attorney could not get any answers, and we found out that he had died in hospital at the very last minute. And so we had been working with other community organisers to raise awareness about this egregious situation that had occurred, and we couldn't have done that without those partnerships. And what in thinking about this, it also makes me want to remind people is that the collaboration has to happen across the board, because we have to look at people holistically, just like we look at these issues holistically. So when I'm working with someone as an attorney on their immigration case, I actually need to be collaborating with you all as physicians, because there are health issues that this person's dealing with as well. And you know what? It's not just that. They're also likely grappling with housing issues, and all of these things are interconnected, and we're going to achieve better results if we look at the whole person, right? If I'm trying to assist someone with their immigration case and they are panicked because the person that is their sponsor now is not taking good care of them, what's going to happen? If you're trying to get someone to follow up with a type of medical treatment and they're getting in trouble at school because they're not getting the language access that they need, how are you going to treat them? And so until we look at people holistically and start to work together on every level, we're really we're making this hard for ourselves. Sorry, I feel like I opened a can of worms with that one, but
No,
important issue to raise with physicians while I have a captive audience.
Yeah, no, that was great. I think this is exactly what we're trying to encourage all of us to think more about and be more deliberate about, you know, not just thinking this is what's happening right now in my office in these four walls, but thinking about everything else. And I think certainly the legal issues, which many of us may not feel as comfortable understanding, often have so many different ramifications as well with that. So thank you. Kara, did you want to say something? I saw you unmuted.
I was just going to ask what strategies she's found like help to like coordinate that advocacy across like different professions or with different groups in your experiences.
It's a great question, and we're exploring it more and more ourselves. One of the sort of structural things that we've put into place is a collaborative. So we have we call it the collaborative, unaccompanied minors, where we bring together a range of service providers every second month, and this has grown over the past few years into quite a large group. And there we'll have people that can provide help with mental health issues, or maybe it's how to sign up for school and education, or maybe it's where undocumented folks can access free treatment. And so just making a space where people get together and can know who each other are and provide each other updates and figure out how to do referrals. So that's one of the things that we've been working on sort of at the structural level. On an individual level, where I think it's sort of over the past few years really just recognizing first off that this is a critical need, and you know your regular staff attorney with a full caseload is not going to be very good at doing all of this and doesn't have the skill set. So we're actually piloting a program where we have a case manager, a navigator, and a coach for a portion of our clients to help them find those other services, because we know, like through the county, for example, there's a lot of services available, but people just don't necessarily know how to find them and access them, and it's complicated. So we're looking to actually include some of those kinds of people on our staff to help with that coordination. And then the third part is finding external partners. So who has funding to be doing this kind of thing? One example of this was an organization called Seneca, and they had funding to provide formerly separated families with mental health services. We had to find them and they had to find us, and we had to find the client overlap. None of that structure was in place. So recognizing it and then investing in it, I think, is a starting point.
If I could also add on to that, I think that that's spot on. And then thinking about approaching residency and what that might look like in residency and beyond even is one of the keys when you're doing cross collaborative work, whether it's across departments or across different specialties and different sectors, is to find someone or an organization or something that can be a hub, that a person who can be the who connects all those different organizations, who has the time and the energy to focus on that, so that they can be the ones to manage those longitudinal relationships. Anytime that there's lots of different groups involved, it really works best when there is one or a few people who are central to it, who are sort of organizing all that. And in residency, I would say if you are interested in doing any kind of interdisciplinary work or beyond, it really helps to find those faculty mentors or community organizations or someone somewhere who can be that hub for you, because you likely won't have the time and the consistent time really to develop that in a way that's sustainable.
I think I would agree with you, Grace. And I think something that I have found to be just increasingly important as I get further is just striving to understand the dynamics and the relationships and the politics, like little p, like interpersonal politics, and just being so cognizant of the history of, you know, you're probably not the first one to ever try to bridge like legal and medical services in this particular way, and learning from that and trying not to just repeat mistakes, or not mistakes, but I guess I would say if past arrangements had a lot of momentum and fizzled out, trying to learn from that. And so like one thing that comes up over and over again with us in our clinics, especially outside of pediatrics, is whether UCLA takes Medi-Cal or not, and the implications for our patients. And I think a lot of residents have gotten really energized around that issue at different times, and have, you know, really tried to place like demands on the administration. And I think, I guess this is less an example of cross collaboration and more an example of politics and history, but I think the lesson stands is this is something that's been going on for 25 years at UCLA. And I think the more that we can think of ourselves as sort of carrying on a torch, or building on past work, rather than the sole people responsible for working on this issue for the first time, I think that perspective is really helpful.
Yeah, I just want to add that, like, I think I really agree with you have to spend the time to build those relationships. I know for sure for the work that we do down in Tijuana, you know, a lot of it was just being really consistent over a long period of time to get people to realize that we could be counted on and trusted. Because I think a lot of groups do come and go, and there's not that many people who stay involved. And so just, you know, if whatever it is that you can give of yourself, just being really upfront about that, and then just trying to be consistent is probably the most important thing. And maybe if you can't be consistent in residency, then that's not the time for you to get involved in that particular thing. Because I think a lot of what I've learned from being consistent, and the comments that I've gotten and the feedback I've gotten back, is that that's something that a lot of groups have not seen in people who have come before us. And so I think, you know, you don't have to be some amazing, crazy superhero. You just really need to be there. It's like being a good friend, you know? You don't have to be the best. You don't have to be like this amazing friend who like sends your friend dinner every day. You just like need to be around, you know? And so I would just like encourage that as like a mindset.
Thank you. All of that is just like really great advice. Any other questions from the group? I have a few things I can add, but I really want to make sure that the students here have a chance to ask these wonderful experts their questions.
I wouldn't mind just building on what Hannah raised if no one else has a question, which is the consistency, but also doing something. So I mean, I recognize that as residents and then as doctors, you're all going to be incredibly busy. You are and will continue to be incredibly busy people with very demanding schedules. I know it. I'm married to one, and it's hard to pin him down for things. But I guess, you know, being on the legal service provider side and the nonprofit side, and spending a good amount of time thinking about engaging folks and keeping them engaged. I think that, you know, not flaking out is important, but that doesn't mean you have to give everything or nothing. Like, there can be a little bit of a middle ground. And so, you know, my ask to people often is, you know, just as a start, be engaged with the issue. Try and be informed. You know, you're not sure where to start, follow us on social media. We post news articles all the time. We're engaged in advocacy, sharing what's happening at local levels, national level. Just have a sense of the issues. Just being able to do that means that when you're engaging with other people, you know, you have the ability to use your voice to tell them what's going on about the injustices you see, about the inequity you see, and you'll be more comfortable with the issue. Over time, that might shift. You'll have a period in your life where maybe you do have more flexibility, and yeah, maybe you'll do consults pro bono, maybe you'll join a board of a nonprofit, maybe you'll just donate $20 a month. But you know, there are so many different ways to be engaged, and I really recognize that we don't all have the capacity to give everything at every stage, and that shouldn't prevent you from, you know, engaging at a level that you're comfortable with.
Yeah, I'll just add to that. You know, it's a lot of what Grace was saying in terms of, you know, having like a hub that connects and is able to carry those through. So that's where, you know, if there's a group of people that are, you know, passionate about something, really want to work on a project, it may not be that you're the one person that is going every single time, but it's building that relationship, and it's the organization that's consistent, and people can sort of come in and out of that based on their schedules as well. So I think there is a way to be really responsible, but I think the point is really thinking through all of those steps as well for when you're trying to get engaged, and making sure it's really of the benefit of the organization that you're working with, and being very open about what it is those needs are.
And I would add, I think that's true not only at the community organizing level, but also at much higher level discussions, like at the state and federal policy making level. There's, you know, organizations and stakeholders and relationships at every level that you're going to try to be working at. And the power of the longevity and the genuineness of that engagement and receptiveness goes a long way from what I've seen.
I just wanted to ask a question as well of the students that are here, because I know some of you have been involved in advocacy in ways big and small. Just a little bit that I know about each of you. I know of things that you've done or things that you've been involved with, groups you've joined. Would anybody want to share some of that work and maybe any like challenges or opportunities to continue? Don't want to put you on the spot, but it'd be great to hear from you.
I have a question about something. I'm going into general surgery, and I recently got involved with a national organization that involves students and residents, and I'm going to be part of their national team this coming year. And I was wondering from any of you during residency, like strategies you've seen that are effective in getting like different residency programs or different institutions to collaborate in those efforts?
Yeah, surgery. So we actually, Grace and I, so she can probably speak to this too, but we had a great conversation with some of our surgery colleagues who represent plastics, gen surge, I think urology at one point, but about the particular challenges of engaging residents in programs that are already hitting up against that 80-hour a week every single week, and just people not literally having no time to organize or engage in these things. One of the things I heard from them is a lot of interest in pushing programs to do this at the curricular level, so building it into your time as part of your program. And so ways that we've been working across residencies to help facilitate that is that some programs already have a curriculum much more built out. So it's not like, you know, the surgery program, although they do have some people who do great advocacy policy work, not putting the onus on them to maybe develop an entire curriculum from scratch, but borrowing from other programs. So that's been one good nexus of collaboration. The other thing in surgery programs is you guys do get, in many programs, some research years. And so that organization is UACT. And we actually had Dr. Tyra present to some of the programs. So we had the Ideal Fellowship share. I guess we all learned about a lot of the resources that have been developed for Ideal and other programs considering using those. But what was I saying? Oh, there's a couple of residents who've decided to dedicate their 4th and 5th year of research time to more like advocacy or policy research issues.
There's a couple other strategies I would recommend for surgery specifically, or actually this is probably generalizable, but highlighting what other programs are already doing and saying, hey, this like highly ranked program, you know, this very competitive program is doing X, Y, and Z. I've been seeing a lot of interest amongst applicants, like, can we do that? If that's one way to get traction with program leadership, if you're trying to get support. I don't know what the application season looks like for you all, but I can say on the PEDS side, I had so many questions from applicants about what our anti-racism work looked like, what advocacy looked like at UCLA. And so my sense is that students and residency applicants are looking more and more for that. So you may be able to find some support within your program for initiatives along those lines. And I guarantee that there will be at least one faculty member who probably is a little bit more passionate about that than others, who can help spearhead any of those efforts. Most surgery programs, I think, also have that research year built in. And so those are going to be the residents, like Abby said, who have a little bit more time to be leading any kind of efforts. And so would be, I think, probably be a good idea to reach out to those folks who are going to be rising into that year, or, you know, both the folks who are leading that year and those who are rising into that, to see what is being done and what they know to work at your particular institution. And then reaching out, you know, you have the luxury of, it sounds like the national board of folks to reach out to ask for their advice on what works at their different institutions too. And we're always happy to help too.
Thank you.
Yeah, the other thing you can do that has a lot of national reach is like the resident union, because they already have those networks really well defined. So I mean, not that you have to do it through the union, but you can use the union's reach to, if you just get one of your people to try to be like a delegate and go to that national conference and kind of like spread out the information that way, that can also be really helpful. I can say my sister's a general surgery resident, and she does almost exclusively social surgery, or whatever you call it in surgery, kind of public healthy surgery stuff. And I do know that during her research year, there was quite a lot of pushback, not from her advisor, but from other members of the leadership about like whether that was considered legitimate research. I'm just telling you, giving you a heads up now. So it might be good. I think it's good, like for you guys as like a department and as residents and stuff, to like start talking about that as like, yes, it is very important in surgery. Like it's just as important in studying, you know, sepsis and, or, you know, some ICU study that they want you to do. And I do know that, you know, it can be a little bit tricky politically sometimes in the surgery departments. So just something to consider when you're going forward with your plans, if you consider using your research year for it.
Thank you to everyone. That was really helpful.
And to that end, I think just for anything you want to do in residency, finding some faculty mentors or more senior resident mentors, but faculty mentors in particular can be really helpful early on to help you kind of navigate these things.
Abby, do you have some advice on how they might navigate that? Because sometimes it's not so obvious when you first join a place.
I can tell you what I did. So when I first got to UCLA, I can't remember how I think I just Googled like 3 people at UCLA who I thought might have research interests similar to me. And I just met with them and I said, hey, I'm an intern. Sorry, there's some loud noises going on beside me. I have a 5-month-old. She's participating too. And then I think just having a couple of initial conversations, and telling people what I was interested in, then that led to more connections. And so even now, like literally an hour ago, I just emailed a pediatrician who I had met with as an intern and then again as a second year. Never really worked with her, but just like I kind of found her as a supportive person to bounce ideas off of. And so just finding those mentors, I think it's hard on paper to know who they're going to be, but just having at least meet and greet kind of conversations has been really helpful to me. And I would say judging almost more based on like personality and vibe than their specific research interest being exactly yours.
Yeah, definitely find your allies in medicine because, you know, when you speak up, you're going to need them. So finding people who get you and are going to support you when you speak up, especially if you're speaking up in a way that kind of is going against the grain of the conservative base of medicine, I would just make sure you have allies. I have personal experience on that front, and you need to have some sort of support or someone who supports you to get through that and to kind of keep you going. And I mean that in like a really serious way. Like, I mean, I definitely, for me, it got really bad. And I think, and I actually have a friend who was just actually fired from residency for being a whistleblower. Basically a surgeon assaulted a patient and the patient filed a police report against the surgeon, and this resident testified, went and gave a statement to the police because the police asked her to, and she agreed with the patient. And the residency program didn't like that because they thought that she shouldn't have done that. And basically they found a way to fire her despite the fact that she was resident of the month for her program and also resident of the year for her entire hospital. So, I mean, obviously she's suing the hospital and the program, but you know, she didn't really have a strong ally base when she spoke up, and that's not her fault. Like, she did the right thing, but just so you know, these things do happen, and this happens to be a residency program in California, so it's not like it just happens in, like, you know, somewhere in the middle of North Dakota.
Thanks for sharing, Hannah. I think that's such important advice, and I think that it's good to find those allies and also find not just your peer allies, but finding exactly like as you're looking for mentors, and if you think you're going to take some sort of action that maybe the residency may not look fondly on, you know, having those conversations up front, strategizing, having that support. I have to say, as a junior faculty member at UCLA, I'm like so grateful that I have Alice Clow as my division chief, because she's definitely very supportive in a lot of the advocacy initiatives. So it's like, it's good to know that at the end of the day, I know somebody's going to have my back, and that person is high in leadership. And so that, I think, is always really helpful to identify those people and make those connections. not sure if any of the other students have any questions, but I would love, for all of our panelists to maybe share, we're all busy kind of in your day jobs, and then this is often can be very taxing, just not only with time, but also I think oftentimes there's like an emotional toll sometimes as well, really advocating and doing this work. And would love to hear kind of what you do to help you stay energized and stay kind of committed, and how you take care of yourself through all of this.
I can go first because I'm going to have to jump off. But I would say a lot of this work for me is where I find my sense of energizingness, I guess. I think that the medicine half of things, while very interesting and fulfilling, it can be hard, especially when you're like an intern, a med student, and a senior resident too, to a certain extent. And it's just hard to feel that you have agency, and you see these terrible things happening, and you can feel like very powerless to affect them. And so I think having another outlet outside of sort of the traditional medical infrastructure is for me a very protective measure to help me feel like I can make a difference. I mean, and I think apart from that, not taking yourself too seriously, making sure you're like doing things outside of medicine and sleeping and having friends and family, and all those traditional ways to take care of yourself too.
I can go next. I burned out of teaching, and so for me, one thing that's been really important for me in medicine has been to give myself permission to not do everything all the time. I have to remind myself that this is a marathon, not a sprint, and that I do more harm in the long run if I'm trying to do everything all the time. And I try to remind myself that when I take a step back, that's it's not like the world is going to collapse because I didn't do, whatever work for the day. And it's an opportunity for others to step up and to fill in that space as well. And so I think giving yourself the permission to take a break when you need it has been really helpful for me. That and therapy. Highly recommend therapy.
I'm going to have to drop off in a second for a bath time also. But I feel like as we're talking about balance, kind of it's time to make that confession. I don't think it's appropriate for an attorney to give advice to doctors on how to get through. Your work is challenging on a level that I don't experience. But I would just say something that I say to our staff all the time, that like balance is a goal, and sometimes you have it and sometimes you don't, and kind of recognizing that and not thinking that you're going to have like this perfect balance every day. Some days it's not going to be balanced, some weeks, some months are not going to be balanced, but like if you look at your life overall, that's what you're trying to achieve. And are you happy with where that is for that moment now? And the long term and the short term, that sort of society's presenting to us this idea of like every day you need to have like this wellness component, this exercise component, and eat well and have a social activity. And I don't know, that just doesn't seem realistic for me. So I'm looking at it a little bit more big picture. With screaming children. Thank you so much. It was such a pleasure to speak to you, and I'm so humbled to have the opportunity to be part of this group.
Thank you so much for joining us and for sharing, and for all of the great work that you're doing.
Thank you.
Thank you.
Yeah, I probably shouldn't give advice on work-life balance or boundaries. I'm pretty sloppy with mine. I kind of agree with what she just said. I think, it just depends on who you boundaries, and that works for them. And for me, it just doesn't work for me. So I think, there's sometimes when the balance is way off, And there's some times where I'm just like, I need 2 days. Like I can't do anything. I'm just so burnt out. And then I take 2 days to recharge and then I feel good again. And I do think therapy is super, I never did therapy. And then when I started working down on the border, there was just like so much secondary trauma. It was so hard. I think, you know, and everyone that works down there was like, had a therapist. And I was like, oh, maybe I should get a therapist. It really is helpful. And I think you can be a little sloppier with your boundaries if you have a therapist, because then you at least have someone who's trying to keep you honest, and that you have to confess to, you know, every other week or every week or however long you do it. But I do think, you know, in the context of life, you have to figure out what makes you happy. And all the work that I do is so important to me. And there's some days that I have a million patients that are texting me on my private telephone, and, you know, yeah, I give them my cell phone and I text them all back. And is that a poor boundary? Probably, but does it fulfill me in ways that makes my life richer? Yes. So I don't know. I'm not, I think probably like most people would say, don't do it the way that I do it. But I also think that there are variations, and the real important thing is that you have meaning in your life and that you find happiness and that you're not feeling so burnt out that like you can't function. And if that starts to happen, you need to stop and reevaluate what you're doing and then maybe try something a little bit different. That's basically how I've done it. So take that for what it is. And, you know, all of you are going to have to figure that out, because residency makes it impossible not to figure that out. So best of luck.
Hi, you guys. I'm sorry I got paged away, but happy to put in my 2 cents here. I mean, I think what I've kind of learned through the process of like med school and then coming into residency is that often, especially if you're interested in advocacy and you have interests in any of these realms, you're water hosed with different projects or different opportunities and ways to get involved. And I think one of the best things that I've learned is to really make sure that I'm investing my time into areas that I know are going to, that I'm interested in and passionate about and feel fulfilling to me, and not just saying yes to any opportunity that comes through the door. And that's part of that balance. And I think in that way, that also kind of helps you kind of like what we've all been kind of saying is like create those spaces and times that you want to create for your outside of clinical work activities. So I think that that's probably been like the biggest thing for me during residency, and now even with chief here, I only do the things outside of my clinical time that I want to be doing, and not just saying yes to anything just because maybe my skill set is appropriate for that type of project or so forth. And then of course I will also third that therapy plug, because it similarly is the best way to have an objective person to talk through every stress that you can imagine. So yeah.
Thanks, everyone. Just to kind of piggyback on that, you know, in terms of therapy or mental health services, most programs will have something that's available as well. So I think a lot of things get thrown at you in orientation, but that's probably going to be one of them telling you about like whatever wellness center or mental health services they have. And I think probably not enough of our trainees take advantage, because like not for any other reason, but just residency is really hard. And oftentimes people are having multiple transitions and like becoming a resident, moving, you know, figuring things out, like lots of things are happening. And you know, don't necessarily think, oh, well, I'll just wait until there's a problem and then maybe I know who to call, but really think about making those connections early, so that you have that added support network. Well, I think this has been really informative. I know it's getting later in the evening, so I don't want to take up too much of all of our panelists' time. I don't know if anyone has any parting words of advice or thoughts before we kind of close out, but thank you, everybody. Really, really appreciate you being here and being so open and honest and really just being available to all of us.
I just wanted to say that I've been really inspired. I'm not a medical professional. I'm just, working with the medical student programs, but definitely very energized. And I've been dealing with trying to find more minutes in the day to be engaged with certain issues that have really moved me, that are happening in our society. What just happened in Atlanta on very many levels, a lot of just major problems with institutions and just the way the world works. And it gets so overwhelming sometimes. It's hard to really figure out like how you can fit these things in. So it was just very inspiring to find, a variety of ways of getting involved. Some of them where we might feel less comfortable with. And I don't know that I would be able to risk getting arrested. And I'm so glad that there are people like you that exist in the world, because, that makes change happen more quickly, I think. But this was just really inspiring. Thank you.
Well, great. Well, thank you again. And I'll just ask the panelists if they're comfortable, if the students want to reach out to you, if they have any follow-up questions or want to maybe tag you as a mentor or whatnot. If you're willing, it'd be great. Maybe we can just share your email in the chat for them. Well, great. Thank you, everybody. I hope you all have a nice evening.